So coming to the types of the breast cancer, so depends upon the involvement of the tissue, the cancers are going to be different types. So if you see the different type of the tissues, so these are going to be, so based on the tissues and based on the invasiveness and also based on the hormones. So coming to the based on the tissues, so the tissue involvement is going to be, so if it is the ducts are involvement, so it is called as ductal carcinoma. If the lobules are involved, it is called as the lobular carcinoma. So if the ductals are, so the cancer affecting the inner lining of the milk ducts, so where the milks are going to be productions, so this going to is called as the ductal carcinoma. And also the cancer affecting the parts of the breast, so that producing the milk, so that is called as the lobes. So if it is the lobes involvement, it is called as the lobular carcinoma. If it ducts are, so which carries the milk from the ducts to the and lobules to the nipple regions, so that is called the ducts, so that is called the ductal carcinoma. So depends upon the breast cancers, type of the breast cancer going to be is the invasiveness and also hormones. So this just now we discussed the invasiveness is also is the non-invasive means is a non-cancerous. So where exactly it's not going to spread to the other parts of the body. So that is the non-invasive. Invasive means it's going to spread to the other parts of the body. For example, it may spread from the breast to the lungs, to the lymphatic system, and also through the blood. So if it is it's a non-invasiveness, this is also called as, is known as the in situ. So it's maybe, it depends upon the, it's not going, maybe ductal or lobular. If it is a ductal in situ, that means the ductal in situ means it's going to affect to the ductal regions, and also it's not going to be spread to the other parts of the body. And also if it is effect to the lobular in situ, so it's going to be effect on the lobular. So if it is the effect spreads to the other parts of the body, so it is called as, so it means the invasive carcinomas. So these are invasive in situ is going to be the lobular carcinoma in situ and also ductal carcinoma in situ. So it's not going to be spread to the other parts of the body. So coming to the based on the hormones is going to be the ER positive breast cancers. So that means the estrogen receptor positive breast cancers, and also is going to be the is a HER2 positive breast cancers. Is going to be the related to the hormonal imbalance. So these are going to be the different type of the breast cancer. So we are going to discuss it the one by one here. So first one is going to be the inflammatory breast cancers. So in this inflammatory breast cancers, so this is going to be some most common type of the breast cancers. So it affecting the skin of the breast, and the skin is going to be looks and also feel warm. So that means what are the signs of the inflammatory signs we are going to find in the breast. So these signs are going to be the breast is going to get the swelling and also redness, tenderness, and pain, and also they feel the warmth. So these cardinal features we are going to observe in the breast. So it's going to get you can see here, the swelling is there, redness is there, tenderness also there. So these are the major features of the inflammatory breast cancers. So it also makes the skin looks thick and also pitted and may have the orange peel appearance. So if you see here, this structure is going to be orange peel appearance. So because of the redness and also because of the swelling. So the breast may be bigger and also hard and tender and also itchy. But here we are not going to find any lumps in the breast. So there is no nodules and lump, but the breast is going to get the hard and also is going to get the tightness and may give the swelling. So is the hard is to diagnose, it doesn't show well up on the mammogram. So it won't go and shows any defects in the mammogram. So there is no lump or anything, but only thing is they may chance to get the hardness and also tenderness, swelling, and also severe pain, redness. So these are the major symptoms we are going to find in case of the inflammatory breast cancers. So it is more aggressive and also spread more quickly than the other types of the breast cancers. So who are having this like a tenderness and also redness and swellings. So this inflammatory type of the breast cancer is going to be spread more faster than the other type of the breast cancers. So this is going to be diagnosed at the younger age, especially among the African women. So according to the statistics, so these inflammatory breast cancers are going to be more found in the African women, and is more likely to affect the overweight women. So who are the overweight, and also African women are more prone to get the inflammatory breast cancers. So this is according to the research statistics. And also next one is just now we discussed the types of the ductal carcinoma in situ. So ductal carcinoma means is the ducts are going to be affected. So ducts are nothing but which carries the milks from the lobes to the nipple regions. So the is going to be ducts are going to be affected. So here, if the cancer is affected in the ducts, so it's not going to spread to the other parts of the tissues. And also, if you see here, the normal duct is going to be duct is nothing but the tubular organs. So it carries the milk from the lobes to the nipple regions. So in the normal, like a ducts is going to be like the cells are going to be organized in the manner. But in case of the abnormal, that is the carcinoma of the ducts, you can see the extra growth is happening in the ducts. So it's going to be the abnormal development of the cells of the ducts are going to be formed. So these are going to be, so there is no proper like a flow of the like a milk production, milk secretions from the lobes to the nipple regions. So this is going to be obstructions is going to be happening. So the presence of the abnormal cells inside the milk ducts in the breast. So this is going to be considered as the earliest form of the breast cancers. So this ductal carcinoma in situ is going to be the earliest type of the cancers. So there is going to be increasing the size. So the ducts is the cancer cells are going to be increased here. So that is the one type of the like early stages of the breast cancer. So this is going to be non-invasive. So that means it's meaning non-invasive meaning means it won't spread to the other parts of the breast. And also spread out of the milk the ducts and has low risk of the becoming the invasive. So it's a very low risk, only it's affecting the ducts, it won't spread to the other parts of the breast. So it's going to be doesn't typically have any signs of the symptoms. So it sometimes may give the breast lump and also the blood nipple discharge. So it won't give any other complication, any other symptoms, may chance to get any lump in the breast and also any blooded nipple discharge. So in the nipple regions, so we may chance to get the discharge. So that is the one of the symptom in the ductal carcinoma in situ. So another one is the invasive ductal carcinoma. So invasive ductal carcinoma means the symptom, the cancer is going to develop in the ducts, so which carries the milks from the lobes to the nipple regions. But so this is the invasive means, so this is going to be spread to the other parts of the body. From here, it may spread to the like a lymph nodes and also other organs. So if you see here just now, the previously, so in the ductal carcinoma in situ, so it's going to be only spread in the ducts and also only is developed in the ducts. But in the invasive ductal carcinoma, it's going to be developed the carcinoma in the ducts and also it spreads to the other parts of the like a breast tissue. It may spread to the lymphatic system and also it may spread to the other parts of the body. So it's the most common type of breast cancer, is representing the 80% of the breast cancers, the diagnosis. So if you diagnose, so these type of the invasive ductal carcinoma is the commonest type of the breast cancer. And next one is the lobular carcinoma in situ. So it's going to be the lobes are going to be affected. Lobes means, so which produce the milk. So the glands have produced the milks. So there we are going to get the like a cancer development. So, but here also, this also non-invasive one, it won't spread to the other parts. It's the lobes are going to be affected. So if you see that the normal lobes are going to be like a fluid-filled cavities or nothing but, so here is going to get the milk productions takes place. But because of the abnormal cell growth or development, so you can see, you can feel so there is no spaces in the lobes. So all fill the space, the lobes are going to be filled with the abnormal cell development. So that is the lobular carcinoma. So these are going to be, but only thing is going to be, it's not spreading to the other parts of the body. So here there is going to get the abnormal tissue development, the increasing the size of the lobes are going to be happening. But may chance if we won't give the proper treatment, so it may become like the malignant. So that is the major complications about the lobular carcinoma in situ. So coming to the invasive lobular carcinoma. So it also same thing. It will affect to the lobes of the breast. So that means where the milk is going to be production takes place. So here is going to be, but this is going to be spread to the other parts of the body. So this is the invasive lobular carcinoma type of the breast cancer that begins in the milk producing glands, so which are called the lobules of the breast. So this is going to be the cancer is broken out and also is spread to the other parts of the breast tissue through the lymph nodes, and also it's spread to the other areas of the body structures. So it's called as the invasive lobular carcinoma. So another one is depends upon the hormone receptors positiveness. So depends upon the involvement of the hormones. So these are going to be because of the either estrogen or progesterone. So if you, because of the estrogen positive, so it is called as the estrogen receptor is a positive hormone positive. If it is the progesterone hormones, so it is called as the progesterone hormone positive. So if it is positive means the tumors that have the progesterone receptor called as the progesterone hormone, that's a progesterone receptor positive. So if you confirm it the positive or negative, at least one receptor should be positive, either the hormone like either estrogen receptor or is the progesterone hormone. So this type of the cancers may depend upon the hormones, so which are the estrogen and progesterone to grow. And also hormone receptor positive cancers can occur any age, but more common age group in the women who have gone through the menopause. So that means after the 45 to 50 years of age group, so this hormonal imbalance will happen. So because of the hormonal imbalance, so we'll get the hormone receptor positive breast cancer will develop. About 2/3 of the breast cancers have the estrogen and also progesterone receptors. So about more than like a 2/3 of people may chance to get the hormone receptor, either the estrogen or progesterone. So cancers without these receptors are called as hormone receptor negative. So if it is present, the estrogen and also progesterone receptors, so it is called as hormone receptor positive. If it is absent or is in case of the negative, so it is called as the hormone receptor negative. So it depends upon the hormone. Like if you check the hormonal like a test, so if any absent, so we call it the hormone receptor negatives. So another hormonal one is the human epidermal growth factor receptor positive. So these are going to be the abnormality in the like a growth factor, like a imbalance. So because of the growth factor imbalance, so may chance to get the breast cancers. So that is called as the human epidermal growth factors receptors. So these, if you see the normal one, so these are going to be these growth factor, epidermal growth factors are going to be, so gives the development of the normal cells. So if it is the extra abnormal development, is uncontrollable development, you can see the extra development. So these receptors are going to give the more signals, so causing the cells growing to more quickly. So inside, because of this, the human like epidermal growth factors are going to give the more signals. So because of the more signals, the cells are going to be developed more faster. So actually, this is the herceptin. So these are going to be inhibit this abnormal like a hormonal development. So if it is it's uncontrollable, so may chance to get the HER receptor positives may chance to get the breast cancers. And also another type of the breast cancer is going to be the triple negative breast cancers. So triple negative breast cancer, just now we discussed about the estrogen and also progesterone. So these things. So if anybody get the estrogen receptor negative, progesterone receptor negative, and also is the growth hormone and also epidermal growth hormone also if any negatives. So this type of three receptor negative is called as triple negative receptor, like a triple negative breast cancers. So these are triple negative breast cancers are going to be overall 15% of the breast cancer we are going to be identify. So these things are going to be seems more common in the young women, particularly in the Black and also Hispanic women, especially in the Black regions in the African people. So most commonly affecting this triple negative breast cancers. And also this triple negative breast cancers is also more common women with the mutation of the breast cancer carcinogenic genes. So who are having the BRCA1 is a genes. So those people are may chance to get the triple negative breast cancers. And also experts recommended that all people with the triple negative breast cancers younger than 60 age group tested with the BRCA genes mutations. So like a scientist and also physicians, especially the oncologists, so they're going to recommend who got the triple negative ones. So if they check, so it indicates that means who got this BRCA mutations. So those people are may chance to get the triple negative breast cancers. So these are so many different type of the breast cancers. So depends upon the hormonal imbalance. So next one is another type of the breast cancer is the Paget disease breast cancer. So breast cancer due to Paget disease. So this is this cancer is going to be happening. So at the symptoms are going to show at the nipple regions. So, but this is going to be the very rare type of the breast cancer. So that starts in the glands in the skin of the nipple regions. So it's going to affect in the skin around the nipple regions. It slowly grows and also occurs only 1% at the nipple regions. So this is a very rare condition of the breast cancer. It arounds in the nipple skin regions, and also it's around. It's only 1% is made chance to get the breast cancer. Most people with the Paget disease also have the tumors in the same breast, and also these type of symptoms. So these type of cancers are going to give symptoms like inflammatory symptoms, such as the swelling at the nipple regions, and also redness, and the itchy and swelling, which are pain and tenderness may use, and also especially the other symptoms such as the eczema-like appearance. Eczema means how the skin diseases. So how there's going to be scaly appearance. So it's going to give the eczema appearance surrounding to the nipple and also areola. So this type of usually signs of the breast cancer in the tissue behind the nipple regions. So is surrounding the nipple, and also especially is the oozing type or may chance to get the any discharge and also scaly appearance. So this is the one also very rare type of the breast cancer. So these are the different type of the breast cancers. So just now we discussed. So is ductal carcinoma in situ, and also the lobular carcinoma in situ. So either ductal, and also this is going to be the is an invasive type and non-invasive type, and also hormonal imbalance. So because of the hormone estrogen receptor, progesterone receptor, and also we saw the HER2, that is a HE2, that is a human epidermal growth factor also. So these are the some different type of the breast cancers.